All right, Nico, can you say, welcome to another episode of Healthy Births, Happy Babies?
It's a happy episode. Happy babies.
Hello and welcome back to another episode of Healthy Births, Happy Babies. I'm Dr. Jay Warren. I am your host, as well as being a prenatal and pediatric chiropractor here in San Diego. And on today's episode, this is really special for me. I am having a conversation with Dr. Armand Rossi. He's been a mentor, a teacher of mine for years, for my entire career when it comes down to it. He teaches pediatric adjusting with the ICPA. I've learned a ton from him. We're not going to be talking about that specifically on this episode, but our conversation is going to be talking about your baby's innate intelligence and that wisdom that they came into this world with, that grew from one sperm, one egg inside the womb to this beautiful creature that you are either holding in your arms right now or you're about to hold into your arms. That innate intelligence that heals, it coordinates, it allows your baby to be healthy. And he's going to talk with us about concepts of salutogenesis, of nerve interference, and how our babies can be as healthy as possible, as healthy as they're designed to be. By getting out of the way. He has a beautiful message, and it's so timely. It's so important for all new parents to hear, because we get lost in fear and responsibility and having to do things. And he is a great person to listen to calm and to trust and to get back to the basics. And he's a perfect person to do that. So I'm going to switch over to that conversation in a second. Let me play this short message for you. Before we do that, I'll come back, I'll introduce him, and we'll get right into our conversation. My online course, Connecting with Baby During Pregnancy, has been out for a while now, and I've been getting phenomenal feedback from you women who have been learning these prenatal bonding techniques, putting them to use, and having amazing results. The same kind of results that the women in the Rossi study were getting, where by doing these techniques throughout pregnancy, they were having less anxiety and pain during labor. They're needing less obstetrical interventions, including less C-sections. And then afterwards, the babies are sleeping better, which means you're sleeping better. And postpartum depression was less than 1% in the moms who did these techniques. So go over to my website at drjwarren.com/CWB and learn all about it. I think this course is amazing. I put a lot of effort into it, and I think it'll really help you have a healthier, happier, and more relaxed pregnancy and a gentler yet powerful birth. All right, so my guest today is Dr. Armand Rossi. He began practicing chiropractic in 1976 in Margate, Florida. I hope I'm saying that right. And after decades of serving families from all over the area, he's now the Dean of Clinical Sciences at Sherman College of Chiropractic in Spartanburg, South Carolina. He still lectures around the world, although above all, his most prestigious honor is that of having 2 and 3 generations of chiropractic patients receive care on a regular basis. He and his wife, Terry, live in Inman, South Carolina. They have 4 children, 11 grandchildren, and 6 great-grandchildren, although I think, based on our conversation, that needs to be updated because I think he has more than that. We'll find out in our conversation. Let me switch over to it right now, and that's my conversation with Dr. Rossi. All right, Dr. Rossi, welcome to the podcast. Thank you for joining me.
Thank you for having me. I'm excited to share.
Yeah, well, I took your course years ago. We connected there, but I'm glad to have this space. We have a one-on-one conversation for my listeners to listen in and get your wisdom. You've been taking care of parents, new babies for a long, long, long time. So you have a lot to share. And before we get into all of that about, starting your kid off as healthy as possible, share a little bit about yourself. We heard your bio and all the amazing things you do, but how did you get interested in the first place of taking care of kids?
I became a child patient. I was 5 years old, and I had a serious thing. Well, first of all, I was a sickly 5-year-old, asthma, things like this.
Okay.
And then I had a little fall that didn't seem like a big deal. I fell down some steps and scraped up my knees. Didn't seem like a big deal. But the next couple of days, I got very, very sick afterwards.
Okay.
I mean, sick was like a bad flu type thing.
Mm-hmm.
And I didn't want to eat, and I'm in bed, and I can't move, and I get worse every day for the next 5 days. And my mother does a typical thing any mom does. She gives me orange juice and baby aspirin and things like this, trying to get me to feel better, chicken soup. Only I kept getting worse. And one morning she came in and took a look at me. And when I looked at her, my eyes crossed inward severely. And I was seeing double vision, and I couldn't get them to uncross or not see the double vision. So she quickly took me to a cousin of our family. This was up in New York, Huntington, Long Island, who was a medical doctor there. And he examined me, and he immediately wanted me to go into the hospital for surgery to cut the muscles to my eyes and straighten out my eyes. And then they wanted to check to see if I had a brain tumor back then. Okay, now back then, I'm old as the hills. So back then, the way they checked for brain tumor was by injecting the dye into the skull through the ear and taking X-rays.
Oh my god!
Because there were no scans or MRIs or anything like that.
Right.
And so it was an awful procedure. My parents decided that let's see something else. So my mother had an uncle of hers who was a chiropractor, and she took me to him. He checked me over, and he said that I did have some nerve interference up in my neck, and that he could work with that. Now, he also told me this, which was good to my parents, I should say. He said, don't worry, if this isn't successful, we can always go get the surgery done, but let's do something a little more conservative first before you jump into surgery right away.
Smart.
So my mother agreed, and I got my first adjustment, and nothing happened. I was the same. Next day, nothing happened. I was the same. Went through 5 days like this, checking me every day, and I was the same. And my mother was getting discouraged. And here's a lesson for everybody. My uncle said to her, well, wasn't he getting worse every day? And she said, yeah. I said, now he's the same. I said, you understand that's improvement.
Yeah.
If you're getting worse and now it's the same, there's improvement in there. Okay, fine. So we kept doing it. And then we started to notice little by little, I started to get a little more life back into me. I would want to eat, I would want to sit up, and I was starting to get a little better. And about 3 weeks into this whole process, I sat up in bed. My mom walked in the room, and I looked up at her, and my eyes snapped to being straight. Just went right back to being straight, and never had that problem again. Well, and here's another typical thing that people do. Wow, he's better. It helped. It worked. I don't need to come in anymore. And my mother's uncle said, well, no, I'm glad you're better. That's what we wanted to see. He said, but he said, you still have some of this nerve interference in your spine, and that's not fixed yet. So we need to work on that and keep so it stays better. So that's what we did. I went to him initially every day. Then we went to like 3 times a week and twice a week, once a week. And what we noticed was little by little, my entire being was getting better. My physical, spiritual, mental thoughts were doing better, all kinds of things. And within 6 to 8 months, I had no more asthma, no more allergies with that. And from that day forward, the only doctor I went to really was a chiropractor. Okay. That's how I got into it. So when I became a chiropractor, my thing was, and this is kind of funny because I'm considered a pediatric expert now, but I came in to do families because that's what we did. We used to go as a family all the time. And what happened was I started seeing these big family practices and seeing all kinds of people like that. And then Larry Webster said that he wanted me to teach on our program, the ICPA program. And I said to him, I'm not a pediatric expert. He said, you understand you've seen more kids than the experts have. And I said, right. I didn't really think about that, but you're right. And that's how I got involved with it.
Very good. And so is it something where you continue to see lots and lots of kids all the way throughout? Along with everyone else, like in the family?
Yeah, along with everyone else. But I've seen kids. And as I delved into it more and more, I started getting people with referrals from all over the country, basically coming in with their kids for me to look at. And I've done this for lots of chiropractors. I'll look at them, give them my recommendations, suggestions, adjust them maybe once or twice, and send them back to their chiropractor with my recommendations. And we enjoy doing that, you know. You know, I just love the kids. And you know, for me personally, I've got 11 grandkids and now 8 great grandkids.
Wow!
I told you I'm an old guy. Anyway,
yes.
So you know, it's just a blessing.
Right.
Be involved
And
with
I'm
that.
sure with all of the families that have brought kids to you, you must have seen like extreme cases, like mild cases and the like. But one thing I know I learned from you taking your course and just your message is like you have a very, like, I don't want to say simple because it's different as far as salutogenesis is concerned, but like a really great way of explaining like how all of these changes, whether they're dramatic, whether they're small, can happen not only in a baby, but also in the adults. And I would love for you to share that message with our parents.
Sure. One of the things that's important to me is to create health within the body, not just treat symptoms or disease, because that's what happens in America. We don't have symptoms, so we think, oh, I must be healthy because I don't have a symptom. And meanwhile, inside, who knows what's going on? I mean, how many people know when the first cancer cell starts? You don't feel that or anything like this. So we have people who are coming in, and what we wanted to do is create a better environment in the body. So what we do is look at the nervous system, which controls everything in the body. We look for any interference to it, anything that can be altering the mental impulses that come from the brain, go to the rest of the body, and we correct the interference. And in doing so, we're creating a better environment, which creates better health. We're not particularly treating a symptom or anything. So people will come to me and say, well, can chiropractic help ear infections, as an example? And I'll say, well, I'm not here to help your ear infections. I'm here to create a better environment so your body and that power within you, the impulses, can work with working on those ear infections. That's the key thing. So when people say, well, should I come in? And I tell them this, I said, listen, if you're alive with nerve interference, you've got to be better off without the interference.
Right.
It's that simple, okay? Whether I'm going through other stuff, or whether I'm not, if you're alive with the nerve interference, you'll be better off without the interference. And that's what we call salutogenesis. Salutogenesis actually came from a sociologist called Anton Araniski, I think his last name is, or something like that, back in the 1960s. And he talked about that term regarding health in the community. It's better to create better health than to treat the symptom, okay? So he created better health. And so actually, I think Christopher Kent is the guy who really brought it to chiropractic, because that's what we do. We're creating health by removing the interference and allowing things to manifest well. I might give you a little story in this for people who may understand this. Yeah. Years and years ago, Lake Michigan up by Chicago was considered a dead lake. It was so polluted and so awful that nothing would grow. Okay. So what the people did is they were trying to decide what to do to make the lake come alive again. And so what they first did, the first law is they said, well, let's stop polluting it. So they put out laws that stop the pollution. And then they had to decide what to do. And they were debating. And there's lots of pros and cons and what to do and what to do. And then lo and behold, they found out once they stopped the polluting, the lake came back on its own. The processes, the natural processes of the earth and the universe started back up. And see, we're part of that. As beings, we're part of that same universal process. If we can just correct the interference and allow our body to manifest its own life and skill from within, then we can come back from things like this. We don't have to treat a symptom. We just correct the interference and allow everything to function and flow better. Right. It's amazing what can happen. I've seen all kinds of things with that.
I have too, and especially babies, like babies and children, they heal so quickly, quickly. It's so amazing to see that. Would you say that then? I mean, I have a theory that it's because they're just not nearly as polluted. They're not unpolluted, but
No,
they haven't had as many years subjected to that we have. Would you agree?
That's exactly right. I agree with that wholeheartedly. Babies are, are just beautiful beings that have the capability to do incredible things. Okay, as long as we're not messing with them, things like
Right.
this. I mean, there's all kinds of different things you can talk about with that. But I've seen kids just. We had a little girl who was 2.5 years old, and that's like 30 months, right? 28 of the 30 months that she was alive, she had antibiotics.
Oh my
For
gosh.
28 of those months because of problems all the time, always on antibiotics. And within like 2 adjustments, she never needed antibiotics again.
Oh my gosh.
And it's just because she had that ability. She has that innate ability to heal from within, only it wasn't allowed to express because
something was in the way of that.
Yeah, exactly.
Right.
So we call it the subluxation, the vertebral subluxation, that can be in the way of the potential for the body to heal. And that's what we do. That's what we look for. Let's find blocks, rhythm, and let the child take off on their own.
Right. And it's so hard for our new parents. I mean, especially during pregnancy, there's women can and dads too, can like participate in just what a miracle it is, right? Like one sperm, one egg, 9 months later, you have this amazing, beautiful baby. But then once the baby's born, there's this pressure of like, oh my gosh, I got to keep it alive and I got to do the right things. And I have to do rather than allowing the baby to be.
Exactly. Because what you have there is all this energy, this intelligence within the baby that got it to grow. That got as it's growing, the fingers all happen to be the right length. It's not a coincidence. The holes in the head appear right where the eyeballs are. That's not a coincidence. All this intelligence that's going on in there, and then now we think we need the guy in the white coat to tell us what to do after they're born. Okay,
right.
And God bless them; they do the best they can, but it's not the same intelligence from the intelligence of the universe that's been dealing with everything all along. It knows what's best. It knows what way it needs to go, and that's the fun part, to watch them express like that. I had a baby that I adjusted who was in a coma in a hospital, and was in the coma for quite a while, and it came out of the coma in my hands right after the adjustment.
Oh my gosh.
What kind of price could you put on that? That's the life wanting to express.
Right.
And we just need to get there, remove the interference, and get out of the way and let it do its expression.
Exactly. There was a story when I first started practice back in 2000. I worked for a year in a clinic in Costa Rica. And so I spoke a lot of Spanish, but sometimes things get lost in translation. In this case, I was working with a baby. Elpidia was probably maybe a year, but she had hemiparalysis. She couldn't use one arm, one leg. And her parents had heard about what we were doing in the chiropractic clinic and was having me adjust her. And I'd only worked with her for a couple of weeks. And again, kind of like your story as a 5-year-old, there wasn't that much change. Like she was sleeping a little better, digesting a little better, and those are all good things. But, the dramatic stuff of her arms and legs moving hadn't happened. So I go away. It's Christmas time. I went back to the States to visit my folks, and I came back after a couple of weeks. And when they came in for their visit, they were talking a mile a minute. They're like, blah, blah, blah. And my Spanish was pretty good to listen, but when they're speaking that fast, I had no idea. And all I heard was, well, when I saw was excitement and felt excitement, but then also I heard hospital, 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 and I panicked, thinking something really hard. And what it turned out is that they'd been laying her on the couch in a certain direction because she couldn't use the other arm and wasn't worried about her falling off. But all of the life came back in her arm and leg, and she rolled over and hit her head on the coffee table. And they had to take her to the hospital. She was fine for that. But those kind of dramatic stories of it taking time and what's possible then make it a little easier to work with other things that typically parents are asking for questions. And at the same time, it's hard for us to talk about we're going to be working on this specific symptom. And that's kind of going back to what you had said. We're not really doing that.
What we all have miracle stories. that has happened in our offices. But you know what the real miracle story is? Is when mom comes in and says, you know what? This is the first time this winter Johnny didn't have an ear infection. Johnny didn't have a cold, or Johnny didn't have the flu or something like this, and we've been getting chiropractic care this winter. So those are the real miracles. You know, it's not the red lights flashing and the Save My Baby dramatics, but those are the real miracles, is having the children healthier, and all along the way with it. So go ahead. I'm sorry.
And no, it's okay. So one of the things that I learned really well in your course, and you teach other docs as well, is how important it is to check baby as soon as they're coming into the world. In the same way we would check their hearing or their or eyesight, to have their spines checked. Can you explain to a parent like how gentle that process can be? Because it can be scary to hear that a parent's going to bring their infant and over to getting their quote baby cracked, which isn't what we do. But
that's exactly right. We don't do that on babies. First, a lot of it is our observation, you know, to see what's going on and observe that. Then we'll do some palpation. We work with the baby, not on the baby, okay, and get that correct, find out what we need to do. And then usually our adjustments is, and I like to use my hands. Some people like to use instruments, but I like to use my hands. And it's about as much pressure as checking a tomato for ripeness, okay? If everyone who's listening to this, if they could put their finger on the closed eyelid and just use enough pressure so you're not hurting yourself, just feeling the pressure of your finger on your eyelid, that's the amount of pressure we use on a baby. It's that gentle, it's that simple. As a matter of fact, 50% of the kids who come in who are asleep in their carrier, I'll work on them and they don't even wake up. They just stay asleep. And so that's how gentle. That's one of the things the new moms need to know, because it's not, they have, when they're changing their diaper, there's more trauma there than when they get an adjustment. Okay, it's very, very gentle, very loving, very specific. It's not some gross manipulation. That's why we call it an adjustment. It's very specific, very gentle, and very straightforward. So,
and very specific is the key, right? Because then people would think, well, if it's only that much pressure, like how is it making all these different changes? But it's the right pressure at the right place at the right time in the right direction.
That's correct. Exactly. It's a way to describe it. I went to a chiropractor's office one time, and he was having difficulty getting kids to come in. And one of the reasons was because he was a fairly forceful adjuster with the adults. And the adults assumed he was going to adjust the kids the same way. But then once we showed them, we used our pinky on their arm and just took our pinky and touched it and just slightly torqued it. And I said, that's how it is when we adjust the kids. All of a sudden, his practice was loaded with kids because that was what was holding people from bringing them back. They liked him. They loved what he did, but they wanted to make sure it wasn't hurting the kids.
And that extra explanation is so important for parents, because even for me, like I specialize in lower force technique. So even in the dads and grandparents, I'm doing low force stuff. But still, when you're handing over your baby to a relative stranger, I'm a parent. I know what that's like. So I tell them oftentimes it's just going to look like I'm holding him for most of the time. And that, I'll pass them back after a little while. I'm like, really, that's it? And then with some changes happening down the line, they'll know the quote that I did something, but it is super gentle.
And what an honor it is for someone to turn over their newborn to you to check. And,
absolutely.
That's like the biggest honor you could ever give me or anybody to do that, because, you as a mom or dad, you'd throw yourself in front of a moving train to protect your child.
Right.
Okay. But and that's why, I always assert with them that you can feel very comforting and calm, and I don't do anything that's quick or is forceful, and I let mom or dad know everything I'm going to do before I do it, so that they can feel comfortable. In there. And I'm now working on 2 generations. I've actually had people who are grandparents now who were kids when I started in practice.
Fantastic.
And that just shows you how old I am. But anyway,
right.
But no, we do have have fun with that. And we do enjoy, and our practice is like a family atmosphere. It's like a party. We all have fun in the office. We laugh, because laughter is healing. And that's a big part of it too. The kids all have fun. We play games. I used to have this one little boy who he would run around the adjusting table on his hands and knees, and I would chase him on my hands and knees. and then he would giggle and giggle, and he'd jump up on the table to get adjusted. And I did this every time they came in, and it was just like a little ritual we had. It was a lot of fun. And one time the mom said to me, I've never seen his pediatrician do that.
Right.
And I said, well, I bet you haven't, because one of the things in our office, we used to tell people, in our office, your health is significant, but it doesn't have to be serious. We have a lot of fun with it too. And that's part of it. And the kids love it.
Yeah.
They come in, they love it.
And sometimes, especially if they've been going to pediatricians a lot and other things are happening in those offices because different procedures, and they might be scared. Yeah. And they need you to know that you're this warm, loving person that's going to take care of them and help them feel better. And not that the pediatrician isn't necessarily, we're just doing it in different ways.
Just different ways like that. And,
exactly.
And, they become family. All the kids become family to me in the practice and with everybody. We just enjoy everything with that. I've been to homes of my patients if they had a home birth, and I've been there checking both mom and baby.
Beautiful.
I've done many of those. All kinds of interesting things, and it's kind of neat because the kids recognize you. They recognize you as a being, not so much as a human, but as a being. Okay. And you have this connection with them, and you have fun, and they love you. And I had a little girl who was on the autistic spectrum, and the mom really wanted to see if we can get her better. And I wasn't treating her for anything, obviously. I was checking and removing interference. And one day she comes in and she runs up to me with her arms up, and I pick her up, and she gives me a big hug and lays her head on my shoulder. I thought that was so neat. And I look at the mom, and the mom is crying. And the mom said she's never done that with a man before. Even her dad, she couldn't do that with. And that's part of the connection. That's part of the energy. That's part of the beautiful creation of health that comes from chiropractic care.
Yeah.
With that.
Beautiful. Well, Dr. Rossi, thank you so much for being here today and sharing your wisdom. I'll send links to the ICPA, which has links to be able to find chiropractors, hopefully doing the work that you're doing all over. But in our last minutes, what's the major take home you'd like a parent listening to this? They're either like a brand new parent or getting ready to be a parent and starting that new journey, or maybe they're already started their journey with their kids. What's the major take home you'd like them to hear?
Let's go back to the people who are getting ready to be a brand new parent. I think, if you're going to plant a crop, you make sure the field is set up right. Okay. So, if you're going to have a baby, make sure your health is doing right. Make sure you're setting up everything and then make sure that you learn to do what's necessary and right for the child. And that includes getting the chiropractic care so that you don't have interference. And I know many, many new people who are listening to this, may not be afraid. What I always did in my office was I invited people to come in and just watch. I take another baby there and I let them watch how we do it so they don't have to feel afraid of things like this. And, it's far worse, like some of the things we do for our kids in the name of health than what we're doing with chiropractic as far as the way we love and care for the kids. And come in, find a chiropractor or go through the ICPA, find a chiropractor near you and ask them if you could just come and observe a child's adjustment.
Good advice.
So you can feel better with that. That's a big thing. We did that all the time.
Very good.
With that. So.
Very great. Well, thank you so much again, Dr. Rossi. Thank you for everything you've taught me over my career. I'm loving being able to talk to you one-on-one in this way. And then thank you for sharing the message for all these new parents.
Thank you. I appreciate it.
Hi, it's Dr. J again, and I want to thank you so much for listening to the podcast. It's something I really enjoy doing, and I, as a parent, learn a ton from these experts coming on and sharing their wisdom, so I hope you're getting a lot out of it too. And I want to share something else with you. I've created a guide called the 40 Ways to Connect with Your Baby During Pregnancy. It's full of simple things you can do on a day-to-day basis that will help strengthen that bond that you have with your baby. It's a free download. You can go to my website at drjwarren.com/40ways and just enter your email. I'll send it right to you. You can download it and start working on it right away. All of the research that I'm learning in the fields of epigenetics and attachment parenting is showing that the more bonded you are during your pregnancy with your baby, the better the birth is going to go and the better parenting is going to go, because you have that strong foundation, a strong connection to build upon. So go again to my website. It's drjwarren.com/40ways and get that free guide. And again, thanks for listening.